Hi, my name is Jacob Mansuela. For the final for this class, I picked to do my presentation on physical therapy. The reason I picked physical therapy is because I have gone through physical therapy uh, in the past after a surgery, and it was very helpful. My goal is to pursue kinesiology and become a physical therapist to pay the kindness I received forward, as well as to help people who need physical therapy like I did after my surgery. So, what is physical therapy and what do they do? Physical therapists are movement experts and know how to fix a motor injury. Physical therapists help patients maximize their ability to move and function well throughout life. Physical therapists can work on anyone from infants to the elderly. They also help with rehabilitation post surgery, range of motion, back pain, and physical therapists also teach patients ways to help prevent future injuries by teaching therapeutic exercises, which are like at home exercises you can do pretty easy. Physical therapists can even treat lymphedema, I think that's how you pronounce it, which is a condition where there's a buildup of fluids in the lymph nodes on the body, and they're able to like fix that. On the bottom of the page, I have a fun fact. Uh, I'm not even going to try to pronounce that. Uh, it is the word physical therapy in Sweden. That's the word they used up until 2014. It actually meant someone involved in gymnastics for those who are ill, which is, I thought, was something interesting I wanted to share. So, a typical day for a physical therapist. A typical day for physical therapists consists of consulting with the patient to learn of the physical condition and symptoms that they are experiencing. The second step is to identify the movement dysfunction. The third step is to create treatment plan for the patient. Fourth step is to teach the patient therapeutic exercises. And the fifth one is to perform the therapeutic exercises with the patient and massage the problem, the area that's causing the problem. And that's basically what they do with each patient. So repeat steps 1 through 5. So how to get started or how to start getting involved in physical therapy. So first of all, you need to graduate and have a bachelor's degree in a health related field. And then the second step is to apply student accredited doctor of physical therapy or DPT program. There you get your degree. But for that, in order to apply to the program, you need to have completed the prerequisite courses to apply, which consist of physics, kinesiology, biology, chemistry, physiology, and anatomy courses. However, SFSU and UCSF have a joint program that offers an accredited program for people to get a doctorate, their DPT or Doctorate of Physical Therapy degree. However, it is very competitive and there are only 50 spots available. The program also gives you hands-on experience with physical therapists at hospitals as part of the program, which is a big plus. So the third step is to acquire your DPT degree. And the fourth step is to study for the National Physical Therapy exam, which is a pretty big test. It has a pass rate of 89% from 2021. The statistics is from people who took the accredited programs. So after that, once you pass the test, you can start practicing physical therapy. And there's a little link right there. So how is this career involved in kinesiology? Kinesiology is the study of mechanics of body movements. Physical therapists use hands-on approach to help patients rehabilitate, which includes applying weight or pressure on body parts, like bearing weight on your leg that you got hurt or had surgery on. It helps you get your range of motion. An example of this would be like trying to bend your arm or something, but it's like kind of stiff after a surgery. So you're trying to just like getting that range of motion back. And the third one would be they help prevent future injuries by teaching preventative care, by teaching therapeutic exercises, which will reduce the chances of you injuring yourself again. Next slide. So what subfield of kinesiology does this career fall under? Out of the 6 subfields of kinesiology, I believe that physical therapy falls under the exercise physiology subfield. Yeah, I think I said that right. I believe that this is the best fit because a physical therapist area of expert is on movement, meaning they know how the body is supposed to work together in unison with all the muscles and tendons, which is like a holistic approach essentially. So they are able to help rehabilitate a patient or even help the patient with the body parts, with their body parts that are like hurt, I guess. By teaching the patient ways they can stretch the part in question that hurts, which is very beneficial. The exercises are also a way to help prevent future injuries for the body parts that are hurt, which this is all knowledge that you learn from acquiring your DPT and passing the NPT exam. And here are my cited sources. Thanks for listening.